My name's Rishona. I'm the nurse practitioner at Huntington Reproductive Center for the West LA office. I work with Dr. Turgeman. Usually the international patients that come to HRC are coming for a little bit more advanced treatment. They've been through some sort of treatment at home usually, and they're coming here for a lot of times for donor IVF cycles or surrogate cycles or both, or they're looking for doing gender selection or GSN, which is testing chromosomes, some sort of PGD, testing different chromosome. If they have a chromosomal problem, they might be coming specifically for that. Most of our international clients at Huntington Reproductive come from Australia, and then the next, I would say, New Zealand, and after that, Europe, England, Germany, and some from Japan. I speak a little bit of Spanish. Most of the staff here at HRC in West LA does speak Spanish. Dr. Turgeman speaks Spanish. He speaks some French, and that's probably it for our staff here. Dr. Turgeman does his consult with a client, and I jump in right after that. Dr. Turgeman tells me about the person and their case and what they're coming in for, and I contact them right after he's finished with his consult. I usually contact them by email if they're international clients, and I introduce myself and I tell them about some of the initial screenings we're going to do, and then I send written information as well, so they get everything written down. I send them the consent package, a list of lab work they're going to need to get started with, so they have it both on email and then they'll get the package at home. I stay in the picture the whole time, so they get their package and they get my initial email and they start working on the screenings, and then from that point on we're really in almost constant contact. It depends on the client and how much assistance they need and how many questions they have, but they will get their screenings back to me, and I'll of course be starting their chart, and then at the same time, if they're working with a donor, we'll be seeing their donor here. I'll be in touch with them about how their donor's doing, how the screening went. I tell them once their donor's cleared. And then if they're doing a donor cycle, some sort of third-party cycle, we're coordinating their cycle. So, for instance, the international client's going to let me know when she gets her period, and I'll start her on medication. And then the donor as well lets me know when she gets her period. I start them both on medication to sync their cycles together, and I plan out their cycles from there. And I get back in touch with them with a calendar so they know what their cycle is going to be like. I do the same with the donor, and we start the cycle, and I coordinate the whole cycle as well, all the way up until the point where they're here in the States. They're having at least one visit with us. They're having their procedure. And I even follow up when they're pregnant, when they go back home, and I tell them when to get their ultrasounds and their lab work, and we're always in touch back and forth with results, so I can help them with the hormone supplementation that we have them on. So I stay in touch with them until they're discharged at 12 weeks pregnancy. It's a little tricky when clients don't want to tell their home clinics exactly what they're doing, and I do leave most of that to them. The truth is, I can't send an order from HRC to an international clinic. They're not going to take my orders. They're not going to take my prescription. So I usually work with the client as my liaison anyways. So I tell the client what needs to be done, and it's up to them to find a doctor to do it. So it really is up to the client to find a doctor that's going to work with them. But if they don't want to tell the doctors over in their country what they're doing, it may end up being a little bit harder for them. So usually if they don't want to go to a fertility clinic for whatever reason, I tell them, or I ask them if they have a good relationship with their general practitioner, and that is usually what those patients end up doing.